Dr. T, and welcome to Clinical Medicine with Dr. T. Guys, I have Dr. Qwesha. She's a ComServe, so I'll be asking her questions pertaining to ComServe, and then she'll be answering just to give you an idea of what ComServe is about and what it is and all of that. Hi, Doc.
Hi, Dr. T. Thank you for bringing me along. Hello, guys. I'm Dr. Qwesha, Yellow Queenie. Those are my names, and I'm working at the clinic as of the 3rd of October. Otherwise, I was working at the hospital from the 3rd of January. Oh, from the 4th. Okay, yeah, from the 4th. Otherwise, practically from the 1st of January up until 30th of September, but because of family reasons, I had to transfer. Otherwise, yes. Okay, yes, so Dr. T has asked me to share with you about the transition from the internship to community service. So I'll be happy to answer your questions, Dr. T.
Okay, thank you so much, Doc. Okay, so Doc, what is a ComServe? Can you just give us a brief overview? What is a ComServe?
The ComServe, Community Service Medical Officer, yes. COSMO, yes. It's that period when you finish your 2 years of internship and then you do 1 year of community service. And when I heard from history, the ComServe, it was there for the bursary holders primarily, so that you don't take the bursary and then you don't go back to serve your community. You decide, okay, I'm gonna go to job at JN after my internship, blah blah blah. So they introduced community service because of that. But now, whether you are a bursary holder or not, you have to do community service after internship, which is meant to sort of prepare you to be an independent medical practitioner. So it's that 1 year of semi-independence. Though where we are working, you are independent already, but you're supposedly supposed to work under supervision. But okay, that's a story for another day.
Okay, thank you so much, Doc. So from what I understand is that after the 2 years of internship, you start your ComServe for a year.
Yes.
Okay, so the ComServe year is mainly to sort of like work in the communities, right?
Yes.
Okay, so you can't specialize during that time?
No, you cannot specialize in community service, though some people, they do write exams like your primaries during the ComServe, so that when you go to grade 1 medical officer post, you have at least your primaries. So it gives you a chance of being accepted in the discipline that you want. Maybe you want surgery or you want internal medicine. So if you've got your primaries, you stand a better chance of being taken than someone who doesn't have anything.
Oh, okay. So, Doc, as a ComServe doctor, what are your responsibilities as a ComServe? What are your responsibilities as a ComServe doctor?
The responsibilities are not different from those of a medical officer. Serving your community, you do everything that is done in the hospital. You don't have a different scope from that of medical officers. So I don't know if you're still gonna ask the question of how does it differ from internship, because now if I approach it from that aspect, it can be easier for everyone to understand.
You can go on, Doc. You can go on.
Because in internship, you remember that most of the time, especially in some hospitals that I won't mention, you are a blood doctor. Like no one trusts you when you just take orders. They will tell you, even if you see patients on your own, you have to discuss the patients with your senior. The senior has to see your plan and agree with your plan. But now in community service, you don't have to do that. So in fact, you are the one who's giving orders, I would say. So you are a medical officer, but with semi-independence, not totally independent. But you do everything that a medical officer does. Like if there are interns, you have to advise the interns as well. You have to supervise the interns. You can give the orders to interns if you are in an area where there's internship training. And then if you are in a hospital where there are no interns, you see your own patients, and most of the time, when we have interns, especially in the district hospitals where there's internship placement when they are doing their family medicine, usually they see their patients, you see your own patients, and then we discuss the cases that are. In fact, you still oversee that the patient, you still oversee the plan of the intern, and also to advise where the advice is needed. Otherwise, you see your own patients, make your own plan. If there's scissors, where there's theaters, you go there and assist. And then in most district hospitals there, we can appreciate the fact that there's no anesthetists. So when the doctors there, in maternity, when they do their scissors, you get your turns of doing either spinals. Because in most district hospitals, they don't do GAs, they only use spinal because of the equipment and everything else that is happening there. Otherwise, also during the calls now, where I was working, you only work alone during the call. You cover casualty, and then if there's Caesar, there's a doctor that is covering maternity. So the Caesar will take care of the maternity patients. When there's a Caesar, you have to leave casualty and you go to do spinal at night. So that's practically the difference between internship and community service. Community service, you are a doctor, but with semi-independence. Internship, you are not independent. In fact, they usually told us that we are not doctors yet.
That's what they always say.
Yeah.
So, Doc, how was the transition for you from internship to ComServe? Was it overwhelming? How was it like?
The only thing that is overwhelming is that attitude. When you write your plan, you say to discuss with senior. But now there's that luxury is no longer there. You are the senior now. But there you are always allowed to discuss with someone when you don't, when you need assistance. You can always call the other senior medical officers. But now you have to make a decision. So if during internship you did not take your work seriously, then you will be in trouble in community service. Because now sometimes in some hospitals, for that matter, there's no senior. You are alone. You have to make a decision now. And then now you can't be, you don't have time sometimes to be calling on a senior and asking, what should I do now? But if you were serious during your internship, so it depends on you, on an individual. It depends on the individual. Okay, well, for me, it was not very much of a great transition because I was doing mostly things that I knew already. Like on my first 3 months, because in some hospitals you rotate, it varies with hospitals. In some hospitals you work 6 months in the discipline that you want to specialize in and your second choice. So you only work in those areas because they don't want to frustrate you and end up putting you in a place that you don't even like. So they are very fair. But in some hospitals, it's a must that you repeat at least 3 months in every discipline. So my first 3 months, I spent it in internal medicine, which is close to my heart. And it was not very much of a problem because the cases that I would see the cases that were complicated, I would discuss it with our tertiary center as I would do in any other hospital. And then it was not a problem. And then, where were we?
So the rotation that you do as a ComServe?
Yes. So you rotate, and then maternity. Okay, sometimes they will tell you that there are disciplines that it's a must for you to rotate. Like maternity, they will say you have to rotate because you will see seasons there. But unfortunately for me, I left the hospital before I could. This was supposed to be my final rotation, so I was going to rotate in maternity, but I had to move. So yeah, okay. In fact, I'm not planning to specialize in ONG anyways. So it's not a loss for me.
So, Doc, someone who is doing their ComServe at the clinic and the person who's doing their ComServe in the hospital, is there a difference?
In the clinic, there are small differences. Like in the hospital, mostly the ARV people, for instance, HIV positive people who are following up on ARVs and stuff like that, they're mostly managed by nurses. And then when they have a problem, there will be, okay, there are even those forms, there are forms that you fill there, a lot of them. I think it's about a 4-page form. The sisters will sign, and then when I check, you do your parts, and then you're sorted. And it depends on which clinic, on the level of the clinic you are in. Like for instance, in a health center. In a health center, like now I'm in a community health center, I see those patients, it's like your OPD kind of life, né? Because you see the chronic cases, the reviews, when they need to be reviewed, they'll be reviewed by you. But for the 5 months, they'll be managed by sisters, they write their treatment and they continue with the treatment, unless now the patient has got something new. Now, during the review, they come to you after that 5 months on the 6 months, so that you can see how is their treatment. Unless in the 5 months they have maybe that elevated blood sugar or elevated blood pressure, then they send them to you, even if their review date has not come yet. And then in the health center again, there's also a casualty area. So when a step chest comes, you have to be there. And when there's a large wound, they can't suture, they will call you to manage. And then some other, even in the antitumors, the healthcare center, there's got children's clinic, women's clinic, there's got maternity, like your ANCs and stuff. So in those areas, when they need a doctor, they will call you to assist. But in a pure clinic, where that is not a primary healthcare center, I mean, that is not a community healthcare center, what they do, they will put a number. They in some clinics, they work according to the booking system. There's a specific patients they want you to see. Otherwise, most of the patients are seen by the sister. And now in a hospital, now it differs, because you will also see the inpatients. You'll also be in a casualty setting where you will need now. You will need to know which patient to admit and which patient not to admit. But in a health center, any patient that you see that you can't manage in a clinic, and some, they need more sophisticated examinations like your ultrasounds and your x-rays. We don't have them in the healthcare center and in the clinic, so you send those to hospital. But in a hospital, you are there, everything is there, the ultrasounds are there, the x-rays are there, so it's you who decide, okay, this exam I'm going to do it, now this one I'm not going to do it. Do I admit this patient? Under which grounds do I admit that patient? So that is practically the difference between working in a hospital and a clinic.
Okay, so Doc, do you think that internship did prepare you enough for ComServe?
Because fortunately for me, I was in Nelson Mandela Central Hospital. I think it did, because there we were allowed to see the patients before the senior comes, and then you do your examination, you come with your differentials, and then you make your plan of action. And then you tell the senior, you inform your senior that this is the patient I have with this diagnosis, and this is the investigations I would like to do on the patient. And then you discuss them with your senior, why do you want to do those investigations? So you get used to it. Now when you go to the ComServe, you are not as, you are familiar with the stuff, because you know, okay, this patient would manage it like this. And then those patients here that you feel like you're not very confident enough, you always consult your seniors. So in some, I've heard, in some hospitals, in fact I've seen when I was a student, that in some hospitals, all you do is take bloods, you order.
As an intern,
you go to blood bank. That's all is expected of you. Even as the patients will be seen by the medical officers. Then if there's an admission, when you're supposed to copy everything the senior has written without even making your own assessment of the patient. So I think Nelson Mandela Central Hospital, it prepared me to be competent enough as a ComServe.
But I think, Doc, because I've worked with you, I think we're doing ONG together.
Yes.
I think it's because of your. I'm gonna tell you guys this. Like Dr. Qwesha is like so dedicated. She's like one of the former interns. Like she's very hardworking. She's very passionate. So for her, I really think she didn't struggle. She didn't struggle on the first first month of being a comserve because of how hardworking she is and how dedicated she is. So I've learned something from her as well. You know, there are people that you would, Doc, there are people that you would watch them how they do things. You would learn from them, but not actually confessing to them that actually, Doc, I'm learning from you. I learned a lot from you. So I think that's why you didn't struggle. That's just me. Okay, so Doc, a last question. What is your... I'm not going to ask the salary, the difference. That one is very confidential. We're not even allowed to talk about that, so I won't ask that. So for someone who's an intern now, or for someone who's going to be starting their internship next year, because I've got a lot of people that are going to be starting internship next year in my channel. So what is your advice for those people who are going to be starting their internship? Because you have been an intern, please advise them during their 2 years of internship, and also what they really need to do in order to make sure that their transition from being an intern into comserve is just smooth.
Okay, guys. First of all, friends. You need friends, guys, because internship can really break you. So you need a friend or two, or even more friends, because sometimes in some hospital, you won't even be allowed to take a post call. But you have got friends, you can always call on them, because the consultants and your seniors, they won't care whether you took post call or not, but they want the job to be done. So you've got friends. In some disciplines, it's very hectic. So you really need that post call at 8 o'clock. You just feel good, you need to go sleep. So you can call on your friend to do your work for you. You do the same.
Okay.
During their time. And
sorry, Doc. So in other words, you are saying they must develop a good working relationship.
Even outside
of work.
Even outside of work, yes. Okay. Because friends, you also need sometimes, hey, we are going. Okay. And you need someone to talk to. And we've seen interns, some getting mental illness, some they would even commit suicide, some falling into depression because they had no one to talk to. So you need to formulate relationships both at the workplace and also outside of workplace. And please do go out.
Sorry, Doc, for cutting you, because you are saying something that is very important. You know, internship is rough.
Yeah.
It's rough. If you think that medical school is rough, I think internship is on the same level. What do you think about that?
Internship is the worst.
It's the worst, ne?
It's the worst. Because medical school, at least the seniors there, like your consultants, your lecturers, they'll be pampering your ego, even though they'll be hard on you. Okay. But internship, you are made to feel worse, like worthless, like you are nothing. Because you are just you are at the bottom of the food chain. So that thing for some people is very hard to survive, especially for people with egos. You see.
And you know, I'm glad that you mentioned this, because it's one area that we are reluctant to talk about. You know, interns, we just want our logbooks to be signed, and whenever we have to give feedback, we always say the nice things, but we know that, I mean, this internship is like, it's heartbreaking. I mean, I don't know how many times I felt like breaking down myself during internship. Obviously, it varies from department to department, but I'm glad that you mentioned that. So guys, internship is just a start of, I'm not scaring you, as she's saying as well. It's just a reality that you are gonna feel it. But yeah, you can continue, Doc.
But you can do your part as well. Make sure in internship that you do your part, that nobody's going to accuse you of doing something else that you're not supposed to have done. So if you know that, okay, you're supposed to do ward work, do your ward work. Make sure that you have done everything that you're supposed to do, so that when you get problems, the department, and sometimes it happens that in one department you find, and then in other department you struggle. Maybe let's say you have got your own personal struggles at home. Now that affects your work as well. So now, if in another department you were useless, they will say even in this department where you have got a problem, they'll say, we know Dr. Nofinman, that one is a problem. So, but if you know that in that other department you were a good intern, like you did your work, you were a responsible intern. In fact, you are a responsible professional, because at the end of the day, an intern is a professional.
Yeah.
So you have to be as professional as you can, so that even now when you have got problems, you have got people to back you up.
Okay.
And then another advice, eat healthy, guys, because it's good for your health. And what am I forgetting? On the cars, I'm not gonna comment
On the
cars. Which don't buy expensive cars, blah blah blah.
Yeah.
It depends on the individual.
Their financial advisors are gonna.
Yes, I read this thing on Facebook. They were saying, another one was asking, should I have this money, and remember that I have to build my home, but I'm not the one who made it fall apart. Now, do I buy the
I saw that as well.
Do I buy the iPhone, or do I start with my home first, and then the other person responded? Then what are you gonna use to take the pics?
Yes, I saw that.
So guys, it depends on the individual, on what is a priority to you. You see, because if something is not a priority for you, if it makes you happy, do it. If you want that Mercedes Benz, and that Mercedes Benz, it makes you happy, and you know that, but think about the consequences, and you know that in the long run you're still going to maintain it. It's not gonna stress you out. Then you can go for it, because
contribute on the stresses of internship.
You see, you don't want something that is going to contribute. Yes. And then what else am I forgetting?
So it's so the question was just advising interns.
I'm a bit
tired.
Circumstantial.
No, it's fine. It's fine. I think we have covered a lot of things, and we've covered important points. I don't know if there's from my side, I don't have any question, but if you've got something that you wanna share, then I will give you the platform.
Okay.
Anything.
Not a problem, Doc. Not a problem. Yeah. That's what I wanted to say here. Go to internship, enjoy yourself. Enjoy, because now as you grow up as a professional, then the time for you to enjoy life, it gets slimmer and slimmer. So internship is that period where you really need to go out there, take vacations, you see, have a good time, because you might never have that again.
Actually, let me ask you this. I've just discovered that we are twins, because I also love internal medicine. Can you tell us about your passion for internal medicine?
Internal medicine, I loved it when I was still a student.
Okay.
In fact, I went through all the other blocks, and then it was my last block. And then that's where I found the reason for me to be in medical school.
Purpose.
That's how it felt.
You found purpose.
That's how it felt for me. I was like, okay, you see, this is why I'm in medicine. This is what I want to do for the rest of my life. Like I used to even mentor other students, my colleagues, which were on the same level as me, the junior colleagues and stuff, and also getting support from my seniors as well. Otherwise, I am planning to specialize in internal medicine if the time allows. But if not, I might just be a chronic MO. Yeah, because even with registrar training, you see,
it takes its toll as well.
Yes,
and that's my fear.
There's a lot of stresses as well I've had, because I've done my research as well. But now I just want to chill now. I want my mind to be calm, because I've been through a lot myself this year. So yeah, I'm still there. Otherwise, I love internal medicine.
So when you were, because you say internal medicine was your last rotation in medical school. So before that, did you have any interest other than internal medicine, like something else?
No.
So you were not sure until you met internal medicine?
Yeah, no, I wasn't sure what I wanted to do, but I knew that it wasn't surgery.
Okay. It wasn't anything to do with theater.
Yeah, the thing is, theater, it's a very cold environment.
Yeah.
It's cold environmentally because there's aircons and stuff. It's cold even interpersonally. I'm a people's person, so I like
engaging with patients.
But now in theater, there's people who are masked and they are wearing the same attire. You don't even know who you saw, and then everyone is the same. So I'm a people's person. I can't. It's very cold. Then if there's only if I would have to go for a surgical specialty, I would go for urology because I don't know, but for some odd reason, I fell in love in 5th year with urology. So I knew that, if I don't do internal medicine, then I may go to urology or dermatology. So those are the only 3.
Okay.
Then I can't do any other thing else.
Okay, fair enough. So thank you so much, Doc, for this interview. I hope you guys are listening and you are taking notes. Thank you so much, Doc.
Thank you, Dr. Nafingwana. Thank you, guys.
Okay, bye.
Bye.